This is the longest bone in the body, and this bone is very important forensically. Alright? Because with the size of this bone, they can always calculate the height of the person. You multiply the length of this bone into 3.7 times. That will approximately give the height of the person. Clear? So it is very important. Second importance is when the fetus is developing in the uterus, to know the maturity of the fetus. Suppose they get a fetus outside, a dead fetus, they want to know whether the fetus was mature. They always look for the lower end of femur. They take femur, they make a section and look for the epiphysis. If the epiphysis of the lower end of femur was present, then it means the baby is more than 9 months of intrauterine life. Clear? So just before 10 months, the baby was thrown away. So that's how we calculate. So forensically, it is very important, height of the person as well as the maturity, fetal maturity. Nowadays we see this even using ultrasound also, we look at the epiphysis. When we talk about epiphysis, all the long bones are divided into upper end, shaft and lower end. Shaft is formed from the shaft is always formed from diaphysis. So it has to have primary center. The upper end and lower end usually ossify by epiphysis. So it is secondary centers. However long it is, the long bones usually have only one primary center. Which is the long bone which has got two primary centers? The whole limb you finished, you should know. Clavicle is a modified long bone. It is the only horizontally lying long bone. It ossifies from two primary centers. It is the first bone to start ossifying. It is entirely subcutaneous. So starting from the medial end to the lateral end, you can feel the clavicle. And this is one long bone. Why it's called modified long bone? Because it's not only horizontal, all other long bones are straight, vertical. Only this one is horizontal. It's not because of that. This, most of the long bones, all of you know, they ossify by what type of ossification? Endochondral ossification. But this bone, though it is long bone, it ossifies by membrane.
Membranous.
So intramembranous ossification. So clavicle has got lot of peculiarities. First bone to start ossifying, two primary centers, it is subcutaneous, it is ossified by intramembranous ossification. Yeah? Okay. I could have asked this question and given 4 marks. Identify the bone, give its importance in OSPI. Anyway, now I have beat the question, I suppose. That question won't come anyway. I can try to see how many people remember all the points.
Real.
Okay, so remember this. Any long bone when we study, we always study the shaft, upper end and lower end. Alright? Okay, now to hold this bone in the proper position, look at the head here. Head should always be facing medially. Understood? But I can hold it like this, or I can hold it like this also. Understood? So to avoid confusion, come to the lower end, you see the two condyles. In between the condyles you have a notch. This is called the intercondylar notch. Clear? This should always face posteriorly. So with this we can say which side the bone belongs to. Understood? Any questions? Okay. So once you know which side it belongs to, hold it in that anatomical position so that we will see the anterior and the posterior surface, you should know. This bone is a very nice bone because it has got all characteristics which are large. Now this is the head. It is almost spherical. Head of femur. If you look at the head, you will have a depression here.
Phobia.
Yes, fovea capitis. Anything to do with the head, capitis should be added. Understood? Alright? Fine. Once you have this, you have another small structure here, another long structure. This is the neck of
Surgical neck.
femur.
Femur.
Remember, there is no surgical neck for femur.
Oh, that's
Or
humerus.
no
Yeah.
anatomical neck like humerus. Humerus has got anatomical neck here, surgical neck here.
Yeah.
But femur does not have all those things. Clear? This is the neck of femur. Neck of femur is always long. Understood? And it is entirely covered by capsule. Capsule does not attach here. Alright? Capsule attaches at this place. So the whole structure is inside the capsule. Understood? Right. So you have the neck here. Now if you come to the side, you will see a small projection here. This is called greater trochanter. Slightly to the posterior, you have a pointed end. This is called
Lesser trochanter.
Now lesser trochanter is very easy and commonly asked, what are the structures attached here? Psoas major and iliacus.
Iliacus.
So put together, iliopsoas tendon is attached here. Alright? Now greater trochanter, if you look at it, it has got a upper border and a tip. See this? This is the tip of greater trochanter. Alright? Now what is attached to the upper border and tip of greater trochanter? You are still in the same muscles. If I ask operator now, you also tell the same thing. If I ask what is attached here, again the same thing. You are near the answer, but that's not the answer. Remember, gluteus medius and minimus is attached here. That's why you get Trendelenburg sign. Clear? Okay. We discussed muscle attachment, we keep on taking time. So this is tip of the greater trochanter. This is the upper border of greater trochanter. Next you have to see on the medial side of the greater trochanter, you will see a depression. See here, on the medial side you will see a depression. Alright? This is called the trochanteric fossa. What is it called? Trochanteric fossa. Clear? Okay. Next important, between the greater trochanter, lesser trochanter and greater trochanter, anteriorly, if you look at it, you will see a rough line. See a rough line? This is because it is between the two trochanter. What is the name of the line? Intertrochanteric line. Here, please all of you participate in telling
I
louder.
believe it's
This is
has-
intertrochanteric
yeah.
line. Similarly, posteriorly, if you see between the two trochanters, you have a elevated structure here. Alright? See here? This is intertrochanteric crest. On the crest, if you put your finger and if you rub the crest, at one point you will find a small elevation. You feel it? Yes, that is called the adductor, that is called the quadrate tubercle. What is it called? Quadrate tubercle. All of you know of a muscle in the gluteal region called the quadratus femoris. Yes?
Yes.
That muscle is attached here. So this is quadrate tubercle. Understood? Okay? Right. Now, why did I talk about this intertrochanteric line? What is the importance? See, I have already asked one batch, color this area, and I had kept a spot test for them, asking what is attached here. What is attached here? This line, intertrochanteric line, what is attached there? Okay, we can give capsule, but something else. Capsule is one, okay, I'll give you, but something more important. What are the ligaments of hip joint? Easiest question. If somebody asks this question, during my school days, college days, I used to be very happy. Because ligament of hip joint is the most easiest. What are the ligaments of, how many bones are make up this bone?
Three.
What are the bones? Ilium, ischium and pubis. What is the name of this bone?
Femur.
I have given a clue. What are the ligaments? Iliofemoral ligament, pubofemoral ligament, ischiofemoral ligament. 3 ligaments. Only 3 ligaments are there. Then of course you have the capsule, and inside the one you have one ligament that is coming here, which brings only blood vessel. This is all is about the hip joint. So remember, iliofemoral ligament gets attached here. Clear? That's why when you extend the hip joint, you get pain here. That is because you are stretching the iliofemoral ligament. So of the 3 ligaments, iliofemoral ligament is the largest, and it is also the strongest in the hip joint. Alright? Okay. And of course, as another student told, you also have the attachment. I told you the capsule is attached here, right? So part of the capsule is attached along the line. Understood? Okay. So this is about the upper end. Okay. Now let us come to the shaft. Shaft is very easy. Anterior, lateral, medial surface are all smooth. When you look posteriorly, you will find this elevation. This is called as the linea aspera. Okay. All right. When you come down, the linea aspera will divide into 2 lines. This is a condyle. This is the condyle of femur, right? 2 condyles. So this area should be called as supracondylar
Condylar ridge.
area. Understood? So the linea aspera, when it comes down, it will divide into 2 lines. These are called as supracondylar lines. Understood? So this area is the supracondylar area, and this area is smooth. Now what is the importance of linea aspera? Name some structures that are attached to the linea aspera. Yes.
Posterior.
Vastus medialis. See, linea aspera is one structure that gives attachment to almost all the muscles of anterior compartment and medial compartment of thigh. Understood? Whether you take vastus medialis, vastus lateralis, adductor longus, adductor brevis, adductor magnus, here short end of biceps femoris, all the 3 intermuscular septum, everything is attached to linea aspera. Got it? Including vastus intermedius. Vastus intermedius extends like this. So everything is attached to linea aspera. Clear? Okay. Now let us go to this important features here. I'm not going into all the details. These are 2 condyles. Clear? So the condyle that is in line with the head, this is the medial condyle. The condyle that is in line With the trochanter, this is lateral condyle. In humerus, there was no condyle. You had only epicondyle. Understood?
Yep.
But for femur, you will have both condyle, two condyles, and when you look at the condyles at an angle, you can see pointed ends on both the sides. These are called as epicondyles. Why should we talk about the epicondyles? Because the epicondyles are the ones that give attachment to two ligaments. Understood? What are the two ligaments attached here?
Interior
the medial
cruciate
epicondyle, you
ligament.
will have the attachment of medial collateral or tibial collateral ligament. On the lateral epicondyle, you will have the attachment of, yes, lateral or fibular collateral ligaments. Understood? Here also in humerus, you would have had the same thing. Two collateral ligaments, radial and ulnar collateral ligaments. Clear? Okay. So here in femur, you will have both condyle. On center of the condyles, you will have the epicondyles. Understood? Okay. Why should we know about the epicondyles? Because see here, this is lateral condyle, lateral epicondyle. Alright? Now just below the lateral epicondyle, you will find a groove. See here, you will find a groove. Go to the lateral epicondyle, just below the lateral epicondyle, you will find a groove. This is the lateral epicondyle. Just below that, you will find a small groove. Do you see that? What is the structure that is present there? Iliotibial tract will straight go to this thing, tibia. All straight ligament, no. Why for all the structures, see in all the bones, they would have marked this and we would have asked the students about this. See this? Why is it so important? Yes? Alright, just think for 30 seconds and drink water. Yes? Yes, time over. See, tendon of popliteus muscle is attached here. How it goes here. Here, what is this groove? This groove is called the popliteal groove. And the tendon of popliteus is present here. Got it? That's why you have the locking and unlocking of the knee joints. Alright? Okay, we talked about gluteal region, right? Which is the key muscle in the gluteal region? Which is the key muscle in the neck? All of you are going to sit for your final anatomy paper, right? Yes. Very simple question. In the gluteal region, okay, let's fix to gluteal region. Okay, what is a key muscle in an area?
Maximus.
It is piriformis. In the gluteal region, it is why should it be a key muscle? Yes, because in relation to that muscle, you will have all the important nerves and blood vessels around it. So a surgeon, when he is operating, he will always make sure that he will first identify piriformis. Understood? And he will be very careful above or below the piriformis. Why? Sciatic nerve is there.
Yeah.
Understood? And when he is above also, you will be careful because you will have the gluteal vessels. which goes to gluteus medius and minimus. Understood? So like that. Okay, in the neck, which is the most important muscle?
SCM? I don't know.
You're not getting the clue. Sternocleidomastoid, I would have shown like this. How many muscles are like this? How many muscles are like this?
Digastric lah, digastric.
Digastric. Which digastric?
Posterior belly.
digastric is the most important. Is the key muscle in the neck region. All right. Okay. Fine. Let's not go into too much of all those things. Right.
What's the triangle called? Digastric triangle.
Next. Just above the medial condyle, you will have a small elevation here.
My phone battery down.
It may not be
30%.
prominent in all the bones. Yes. See this?
Up height.
This is the medial condyle. Above the medial condyle, you will have a small projection. Yes. This is called the adductor tubercle. Adductor tubercle. Why it is important? Why should I of all this I am telling adductor tubercle? Because you want to surface mark femoral artery. Understood? Then you should always take following point landmarks in which adductor tubercle is very, very important. Clear? So you take the meeting guidal point and you take palpate the adductor tubercle and you draw a straight line. That is the surface marking for femoral artery. Clear? Okay. This is the intercondylar notch here. And what is attached to both the surfaces here? See here, this is the lateral condyle.
The ligament.
For this condyle, this is the
Anterior
lateral
cruciate
surface. This is
Cruciate
the
ligament.
medial surface. This is the medial condyle. This is the medial surface. This is the lateral surface. So what is attached here?
Yeah, the cruciate ligaments, right? Anterior and posterior cruciate.
I don't know. Maybe.
With the unhappy triad. Unhappy triad. Is it unhappy?
Correct. Posterior cruciate is one. Medial collateral and lateral collateral, no?
Anterior and posterior cruciate ligaments are attached here.
Correct, no?
To which condyle, which cruciate ligament is attached? You remember the word lamp. To the lateral condyle, you have the attachment of
Lateral cruciate.
anterior cruciate ligament. To the medial condyle, you have the attachment of posterior cruciate ligament. Clear?
The attachment to
So remember, this is the lateral condyle.
Medial.
So what is attached here?
Posterior. Lateral, anterior.
This here. What is attached to this condyle?
PCL.
Clear?
Lateral condyle is
Never try to use abbreviations. Huh?
So this is medial, lateral.
Clear? The reason is very
lateral,
simple.
Anterior, medial,
Because
posterior.
what is the abbreviation that's used in one
Lateral,
country or one
anterior,
hospital will
medial,
not tally with
posterior.
another one in another hospital. Clear? You go to some hospital, they will say CABG. In another hospital again, they will say CAPG. In one hospital, CABG means
Coronary
artery
bypass graft.
bypass graft. In another place, CABG means capillary arterial blood gas, which are totally two different things. Understood? So never use abbreviations. This WhatsApp and other things have come, even they are having tutorials to identify what is the abbreviation used. BTW, what does it mean?
By
By the way.
By
What's WTV?
Something like this. So it does not exactly sometimes, you know, it doesn't go well with senior surgeons or physicians. Because remember, you have to learn only from them. Alright? Okay. So these are the important landmarks you should know. Let us go to TBI. Yes, we are coming to the end of osteology.